Tell me about open heart surgery. That's one of the biggest contributions by an African-American doctor.
It's a little bit controversial, but it is thought that the very first successful open heart surgery was by a guy named Dr. Daniel Hale Williams. In 1891, he actually opened the first integrated hospital called Provident Hospital in Chicago. Then 2 years later, in 1893, he performed the first open heart surgery on a guy who got stabbed in the heart. There he is right there. This guy got stabbed in the heart in a knife fight and rushed into that hospital. Dr. Hale Williams grabbed 6 of his surgeon buddies, 2 more black gentlemen, and then 4 white surgeons. So everyone's standing over him. And during the surgery, Dr. Williams said, well, I think if I cut this little incision and look at the heart, I can figure out what's wrong. I'm oversimplifying, of course. He saw that there was a tear, he fixed it, and 51 days later, this guy walked out of the hospital and lived another 20 years.
Can you imagine being in that room at that time?
Yeah.
I mean, just
No,
such
crazy.
uncharted territory.
Why are you touching with his heart? Why are you messing with his heart?
What are you doing there? And again, it's a little controversial because, unfortunately, history isn't really kept very well on the history of black folks in medicine. And so there are several other white individuals who were thought to have maybe done something similar right around the same time. But in terms of what we think of as open heart now and the techniques that grew from that surgery, it's credited to Dr. Daniel Hale Williams.